The study we performed was an academic investigator-initiated trial in non-clear cell renal cell carcinoma, comparing the combination of ipilimumab, nivolumab versus standard of care. And this was a trial performed in different European countries. Due to the rarity of this disease, we needed many centers for participation. And we included all non-clear cell histological entities and made a stratification according to histology, papillary versus non-papillary renal cell carcinoma, and according to the risk score IMDC. And there was a one-to-one randomization. In total, we included about 306 patients in this trial. And the primary endpoint was the overall survival rate at 12 months. This primary endpoint was met. We had a significant increase by the combination with ipilimumab, nivolumab, with the combination versus the standard of care. And also the overall survival was in median longer in the combination arm than the standard of care arm. The question is which agents have been used in the standard of care arm. Predominantly there was given a monotherapy with a tyrosine kinase inhibitor, mostly sunitinib, and a few patients had the combination of a tyrosine kinase inhibitor with the immune checkpoint inhibitor. After this has been improved by the EMA in Europe. But as in most European countries, there was not yet a reimbursement for this combination. In this special indication, most patients have been treated in standard of care with a monotherapy of tyrosine kinase inhibitor. There was no increase in the progression-free survival, but this can be also sometimes be observed in other solid cancers that with immune checkpoint inhibitors we have no clear increase in progression-free survival, but a benefit in overall survival. If we are looking a little bit more in detail, the patients who had no expression of PD-L1 on the bystander cells, on the tumor cells, if the CPS score was below 1, these patients are doing worse or have not so a clear benefit by the combination of the immune checkpoint inhibitors than those who have at least 1% PD-L1 expression as a combined score. Other subpopulations who seem to respond very well are the chromophobe renal cell carcinoma and of course the non-papillary renal cell carcinoma and papillary in total. So let's say that's an interesting question. What are the conclusions from the take-home message of this clinical trial? We can say that this has been the largest randomized trial in non-clear cell carcinoma, comparing an IO combination with standard of care. And as we have a significant improvement with the IO combination in this disease, we can say this might be a new standard in the subpopulation of renal cell carcinoma.